Selecting a Medicare Advantage plan for you can be difficult when you don't quite know what to look for. Hi, my name is Christian Brindle. I'm a Medicare health plan expert and specialist. I run and operate the insurance agency called Christian Brindle Insurance Services, also known as Everything Senior Insurance. We're licensed to help people with their Medicare health plan in over 45 different states, so we're national. And in this video, I'm going to break down the 5 things that you need to be thinking about and the 5 things you need to be looking for when it comes to selecting the best Medicare Advantage plan for you. Medicare Advantage plans can be best thought of as a conglomerate of coverage, right? It's a combination of everything you're going to need, all neatly kind of bundled together into one plan. But you have to take the good, the bad, and the ugly with whatever plan you select. The biggest issue I see with people on Medicare Advantage plans is they sign up for plans that don't cover their providers. They sign up for plans that don't cover their medications. They sign up for plans that don't have dental coverage when they need dental coverage, and et cetera, et cetera. So understanding that a Medicare Advantage plan is not going to be interchangeable when it comes to the benefits is very important. If you sign up for a plan that has, let's say, a great dental benefit, but maybe it has a poor medical benefit, you cannot change out that medical benefit and just take the dental benefit. You have to take everything that comes with that plan. So with this video, my intention is to break down for you the process that we go through internally to help our clients understand what they should be looking for and what they should be looking for specifically on their Medicare Advantage plans when they're making an option. Truth be told, a lot of issues, a vast majority of issues that we actually see internally on issues people have with Medicare Advantage plans is when they sign up for plans that don't fit their needs specifically. If the right plan is chosen, a Medicare Advantage plan can be a very good option for a certain somebody that it fits their specific needs and preferences. So without further ado, let's jump in. Let's start with thing number 1 you should be looking at, and that is your own situation, okay? Assessing your specific needs. What are the needs that you have? If we use my example from a moment ago about the fantastic dental benefit, maybe you don't have a need for dental primarily, right? Maybe you sign up for a plan that is very strong in dental and weak everywhere else, and you don't really have much of a need for dental benefits. You don't have much of a history in terms of having large dental claims. Maybe you just have only dentures and you don't even need teeth care over the course of time. There could be a multitude of different reasons, but maybe that's what you sign up for, but that's not what you specifically need. So identifying and addressing and assessing what your needs are for your specific situation is going to be everything when it comes to knowing what you're looking for in a good plan. Do you take a lot of prescriptions? That might be a thing that you need to prioritize when selecting your plan. Do you see a lot of different specialists? Do you see a lot of different doctors? That might be something you need to prioritize in your specific plan. So walk into it having a good understanding of what you need specifically, and that will make it all the easier to pick out the plan that's going to work the best for you. Number 2, make sure that you are checking your various medications. I cannot stress this enough. If you take any amount of prescriptions and any amount of expensive prescriptions at that, knowing which plan will cover your prescriptions best is an asset, and it's an absolute priority that you should have if you have any type of prescription drug costs. And I can't stress this enough. One plan versus another can make a dramatic difference in the Medicare world on your specific prescription costs, okay? It can make the difference of a couple $100 a year maybe. It can also make the difference of, maybe $1,000 or more a year. Potentially. And it could make a difference of even more than that if maybe a prescription you're taking may not be covered at all on your particular plan and you're paying 100% out of pocket. So making sure that your prescriptions are being compared. That's where working with someone like me or someone like my organization and my office staff can make it so much easier because we can run prescription comparisons for you. We can make sure that we're picking the plan for you that covers your medications the best. And it can make a big difference. Not only can it make a big difference of prescriptions not being covered, but how they're covered makes a big difference as well. Maybe a prescription is in a higher tier on one plan and a lower tier on the other. That impacts your costs dramatically. So making sure that your medications are accounted for and checked ahead of time is going to be pivotal. Number 3, if you can help it, a big network is always better than a small network. That is my motto. So having more options on where you can use providers is always going to be a resource and an asset for you if everything works out with your plan, okay? There are plans with Medicare Advantage plans that have great big networks that let you go to all different kinds of places. There's even plans with Medicare Advantage plans that cover out of state and have national networks, which is very important for some people if you travel a lot. And then there's other plans that have itsy bitsy tiny networks, and they only give you a little bit of options on where you can go. And there's a spectrum of everything else in between when it comes to that specific plan. So first off, understanding the size of your network. Maybe you just see 1 or 2 doctors and that's all, right? And a multitude of plans will cover just these 1 or 2 doctors. Understanding, okay, even though this plan covers my doctors, is it the biggest network I can have? If it's not, what would it look like to have the biggest network I can have? That's always going to be in your benefit by picking a plan with a big network, mainly because you never know what kind of specialist you're going to need down the road or what's going to pop up in your life down the road, and having more options of providers is a good thing for you every time. It's never a bad thing. Number 4, ancillary benefits, okay? If you do have a need for strong dental, vision, or hearing coverage, understanding how that coverage works and what it looks like. Is it a reimbursement benefit? Do they pay the provider directly? Do they have a large network that covers your dentist or your eye doctor is going to be pivotal. Understanding, does that plan have an over-the-counter item benefit that essentially gives you an allowance that allows you to order items such as aspirin, ibuprofen, fish oil, Band-Aids, vitamins, toothpaste, etc.? Does it have that? Does it have silver sneakers or some other type of gym membership benefit if you go to the gym? Understanding these ancillary benefits is just the icing on the cake when it comes to picking a good Medicare Advantage plan. I don't think it takes priority over your prescriptions, your doctors, and the next thing we're going to talk about, but it certainly is an important piece of your plan that you could make sure that you're getting maximized if you ask the right questions about that plan. Last but not least, number 5 is your medical benefits. How high are your copays for this plan? How high is your maximum out of pocket? These questions help you understand if you're paying more than you need to for a specialist, for a hospital stay, for an emergency room stay. Maybe you have something extremely catastrophic and you're going to hit your plan's maximum out of pocket over the course of the year. Having a lower max out of pocket can save you thousands of dollars over the course of the year. So understanding your medical benefits and understanding having lower copays is better, having low max out of pockets is better, and that's really going to make a big difference if you have a great need for medical visits and medical care. What do you think? What's the most important thing to you on your particular Medicare Advantage plan when you're looking for one? Make sure to comment down in the comment section of this video on what that is for you. What is the priority for you when you're looking at a plan? We'd love to have a dialogue with you about it. And understanding that, in my opinion, for a lot of people, unless you have a very, very specific need, picking a plan that has a nice balance of all of these things is usually a good way to go when you're selecting a plan. So understanding that too, right? You know, maybe a plan isn't the best of the best in one category, but it's an A- in every category, right? You don't want to pick a plan always necessarily unless this is a need for you. That's an A+ in one category and a C or a D in every other category. So I would rather have a plan that's a B+ to an A- across the board in everything than maybe a plan that is super top heavy in 1 or 2 particular benefits. Unless I have a very, very specific need, right? Like I'm taking a prescription that only one plan will cover, or I'm seeing a very specific type of doctor that only a couple plans will cover. Outside of that, having a good balance on your plan is a good thing, but we'd love to have a dialogue with you. Like I said, comment down below. If you found this video helpful, insightful, educational, do us a favor. It's open enrollment period. Smash the like button for the YouTube algorithm. It's going to help so many more people like you find this video who desperately need to hear this information. Make sure to subscribe. We put out weekly videos to help you out with your Medicare and your retirement. We'd love to be able to continue to interact with you on our future videos. Thanks so much for watching. If you need help with your Medicare this open enrollment period, make sure to give us a call, 801-255-5340. Again, 801-255-5340. We're licensed in over 45 states, and we'd be happy to have a conversation with you today about your specific situation. There's no cost, there's no obligation for our services. We'll see you on the next one. Thanks so much for watching all the way to the end. And until next time, everybody, happy Medicaring.